Hi, my name is Rita, or you could call me Priamche. Today we'll be talking about possible questions on infection prevention and control. Now, you could get asked, tell us about a time that you had to look after a patient who was suspected of having an infection, and how did you handle it? Now, the first thing I want you to remember when answering this question is always link your answer to a standard of practice. This makes your answers evidence-based. Now, you could link your answer to the NMC code of practice, or you could link your answer to the local trust value for which you are interviewing for. In this case, we'll be linking our answers to the NMC code of practice, preserve safety. Now, the first thing you highlight is isolation. The first point you make when answering this question is isolation. You need to isolate your patient. That's the first thing you do. Now, the second thing you do is the use of your personal protective equipment. The third thing you do is carrying out a diagnostic test. Now, the fourth thing is proper disposal of your PPE, proper disposal of waste products, proper disposal of used linen, and proper disposal of sharps in the sharps bin. Every trust has their policy on disposal of used linen, so you have to follow the local trust policy on proper disposal of waste products and used linen. Now, the next thing you always have to remember is hand washing and hand sanitizing. You could take it a top notch by saying that you need to wash your hand for at least 30 seconds using the 6-step of hand washing technique, which is palm to palm, fingers interlocked, back to back, fingers interlocked, knuckles of both hands, the thumb inside your palm, you scratch it, and your wrist, then you rinse. This should be done for at least 30 seconds. And you could also highlight the 5 moments of hand washing technique. Now, the next point you make is documentation, accurate documentation, and proper handover to your colleagues. This is very important in infection prevention and control. The next point you make is education of patients and their relatives on infection prevention and control. You could educate them on hand washing technique or handling of waste products like their sputum or when they cough. So just depending on the question that has been presented to you, you educate them on how to prevent the spread of that infection. Now, the next point to make is audit. It is important that audit is carried out. This helps the ward or the department or the trust to understand what area they are failing in the prevention of infection, and this would help them improve in their practice. And the last point to make is detex. Some people always think detex is a bad thing. No, it's not always a bad thing. Detex helps us to learn from incidents. So it is always important for us to detect incidents so that staffs can learn from those incidents and the trust can put in measures to prevent those incidents from occurring again. Another question that could be asked is quite tricky actually, is on you come to work and you see a consultant or your line manager wearing a long sleeve shirt while working within the clinical area. How would you handle it and what would you do? Now, that can be a very intimidating question, okay? So the first thing you do is call that consultant or the line manager to a quiet place, to a private and quiet place. The next thing is to find out their knowledge of infection prevention and control. This is to enable you fill in any gap in knowledge that they might have on infection prevention and control. Then the next thing you do is you fill in any gap in knowledge that they might have and tell them the importance of having an above the elbow shirt all the time when they are in the clinical area. Then the next thing is to find out if they need any training on prevention of infection and find out when last they had their training on infection prevention and control, and ensure that they get booked on a training. Now, this can be very intimidating, I understand, but you need to ensure that you make this point and ask them to make to write a reflection on what had happened and how they can do better. That is how you answer that question. And you could also add that you would do a DETEX on that incident, so that staffs and other senior colleagues can learn from the incident. And measures can be put in place to ensure that such things do not occur again in the clinical area. Thank you very much for listening to today's episode of Infection Prevention and Control. See you in the next episode of possible questions for Band 5 and Band 6 interviews. Do not forget to subscribe to my channel. Bye-bye.